I'm Pro with Fifth Foot U. So today we're going to be talking about how to take a semi-custom orthotic and add some cant or varus. So in this particular case, we're going to be looking at a case of Hallux Limitus. We'll take a look at the x-rays in a moment. But here's what we're going to do with the semi-custom orthotic. We're actually going to put a little bit of a grind on it, and we'll show you on the wheel. Side or lateral x-ray that we just referenced. You can see right up on the big toe joint, the first metatarsal phalangeal joint, there's a lot of extra bone, and you can see that it's also caused a little bit of swelling on top of the soft tissue. So this typically jams up and creates what's called Hallux Limitus, or a limitation in the joint range motion. And we're going to talk about some of the things that we do besides the orthotic as well. In the AP or top view, you can see how the joint is squared off and there's not a lot of space between the two bones here. We're going to take a look at a varus grind. Here is the orthotic, and what we want to do is we want to work the outside, which will be this part, and we're going to put a little cant on it. So for each millimeter, that's probably a degree. I already took off some before. And now what we're going to do to accentuate the varus, to get it to the outside, we're going to build up the inside. We're adding a Cork Lift, and we're going to build up the inside to take weight off the big toe. Thin layer with this German glue, and I've added that to the orthotic and to the posts that we're going to be adding. Then I'm going to use a heat gun just to setting the glue with the heat gun. The heating will ensure a better bond. And then when we're done with that, we just apply the posts to the area that we're trying to lift. And then when we go from looking at this from behind, we'll see that we've added a little bit of a cant there. And then what we're going to do is we're just going to now grind this part smooth so it transitions. You can see from the underside, we've got a little bit of a cant with those posts, and that'll keep, in this particular case, my patient's big toe towards the outside and take a little bit of pressure off the
Where
big toe.
a lot of my patients will have trouble with this condition is right at the push-off, and we can see in the picture there, that's the push-off portion. So sometimes, in addition to the orthotic and toe mobility exercises, and you can reference those on my video, toe mobility exercises for Hallux Limitus or turf toe, we'll add a little splint. This is a turf toe splint that I designed to try to swaddle the big toe joint and give a little bit of first aid support, if you will, right under the big toe to stiffen it up a little bit so not as much pressure goes through the big toe.